Last week, in the first half of the show, we talked about why a rising number of older Americans are ending up on the streets. If you missed it, two big factors driving this crisis are inflated prices in the housing market and the rising costs of everyday essentials like groceries, gas, and electricity. These growing expenses can be catastrophic for older adults who are on a fixed budget, leading to some grim outcomes. Believe it or not, those 50 and older are the fastest-growing group affected by homelessness, according to a late 2023 Department of Housing and Urban Development report. And many in this situation are out on the streets for the first time in their lives. Today, this segment makes up almost half of the overall homeless population in the country. Dr. Margot Kuchel emphasizes how oftentimes other looking from the outside in are quick to draw conclusions about how people got to this point.
To be clear, older adults who become homeless, if you've never been homeless before the age of 50, you are not becoming homeless because you've got a lifelong substance use or mental health problem. That's just not your story. Your story is really deep poverty that comes about because of how poorly we pay workers. And for people who are working these low-wage, physically demanding jobs, we have a society that expects for people to work, 80 hours a week in order to have any chance of making their rent. They don't have pensions, they don't have savings, they don't really have a safety net, and they just really run out of room and wind up on our streets where we know they die at extraordinarily high rates.
Kuchel is a primary care physician and professor of medicine at the University of California, San Francisco. For many years, she studied vulnerable populations and the many effects of homelessness. In older adults who are low income, she's seen firsthand how one health issue, injury, or unforeseen life event can quickly spiral into homelessness. And once a person is in this situation, it's really hard to get back.
By the age of 50, our research has shown that people experiencing homelessness have the health problems, the functional problems that we usually see in housed adults in their 70s and 80s. By the age of 50, people experiencing homelessness are much more likely to experience difficulty walking, difficulty doing their activities of daily living, cognitive problems, and other problems we usually associate with old age.
Out on the streets, people age faster because of the poor living conditions, lack of food, and little to no access to preventative health care. Kuchel says that if you look at someone who's 55 years old and has been homeless for 5 years, it's not uncommon to see the same health problems as someone who's 75. Dennis Culhane, a professor of social policy at the University of Pennsylvania, highlights how this early onset of health problems places an extraordinary strain on emergency room departments, hospitals, and social services.
A disproportionate number of people in emergency rooms are people who are experiencing homelessness. And then because they've not had access to basic health care, they're often, again, hospitalized. And then they have to stay in a hospital longer than the typical patient because they can't be sent home to recover and be cared for in home. So they end up staying longer, costing more, but yet at the end of the day, they are discharged back to homelessness. We're not using these key opportunities, like when someone is hospitalized, as an opportunity to solve their homelessness problem. So we're contributing to the revolving door by ignoring the underlying sort of social determinant of their health services, which is that they don't have somewhere to live, they can't organize routine care or take care of themselves, with daily needs. And it's a sad, tragic situation, and it's not good for them, it's not good for society, it's not good for taxpayers.
Since hospitals are a temporary Band-Aid and not a permanent solution, these people are often prematurely placed in state-run nursing homes or are shipped back to homeless shelters, both of which are already overwhelmed and don't have the necessary resources to properly care for them. Many homeless shelters have bunk beds, communal showers, and tight spaces that aren't safe for older Americans with health issues.
In some cases, this causes shelters to have to turn people away, knowing that they're not safe for them. But then that elder instead is left living outside on our streets.
With no one to turn to and nowhere left to go, many in this group live out their last days cold, hungry, suffering, and in pain. In some cases, they're targeted and assaulted because they're too weak to fight back.
Our studies have shown astronomically high death rates. Interestingly, if you look at the people 50 and over who are homeless, if you were first homeless after 50, you're at an even higher risk of dying than those folks who were first homeless before 50 and remained homeless.
In the end, it all comes back to a lack of affordable housing. Millions of Americans are being priced out of their rentals and homes because of continuously rising costs. For lower-income older adults living paycheck to paycheck or on a fixed retirement income, this can all too quickly lead to homelessness.
There is no county in this country where people can afford to live on a minimum wage. In California, where I live, there are only 24 units of housing that are available and affordable for every 100 extremely low-income households. Extremely low-income households are households that make less than 30% of the area median income. What we see is just this abdication of responsibility. Only 1 in 4 households that meet the very strict criteria to receive rental assistance receive it.
Culhane agrees with Kushel and says that there needs to be big policy changes in Washington. These people have worked hard for decades, and now we're letting them fall through the cracks.
There needs to be a political coalition of folks who agree that we should not have elderly or disabled people living destitute on our streets. And about 60% of the adult homeless population is either elderly or disabled. And it means our social insurance system is broken and it's going to have to be fixed. We need to develop more political will to fix the safety net for elderly and disabled people.
To find out more about this topic, links to resources, and our guests, Dr. Margot Kushel and Dennis Culhane, head to viewpointsradio.org. This story was written and produced by our executive producer, Amira Zaveri. Our studio manager is Jason Dickey. I'm Gary Price.